We don't get to decide when critical care is being given.
People get sick at 3 o'clock in the morning. You can't take systems down at 3 o'clock in the morning.
We have to think about them not just in the context of how do we provide a specific transaction or a specific service, but how do we make sure that that service can be provided all of the time, 100% of the time.
So that's always a huge concern, delivering that day-to-day reliability, uptime, stability that the organization requires. So Spectrum Health right now is sitting at about 22,000 employees, well north of 190 separate buildings that we keep connected. 140 of those actually provide care for our community. We have 3,000 servers, there's over 2,000 databases. We're up over 7 petabytes of storage right now online. So that's a very complex environment, and OST has kind of been riding shotgun with us on a large majority of those implementations.
When I think back 10 years ago, the complexity in both the IT space and healthcare in general was so much lower than it is today. The amount of government changes, the amount of growth, the amount of transition from business to business consumer that's happening in healthcare is at just a fever pitch today.
The demand from the market, the demand from our customers, our members, our patients, they want access to everything. They want it wherever they are, on any device they want. That in turn is driving significant efforts in the development space of the applications we're trying to make available so people can get to their data at any time. Development brings with it the sense of agile, so the infrastructure needs to adapt to be able to very quickly spin up and spin down environments based on project needs so that they can get things rolled out to the market that the market demands.
At the same pace that we are maturing in our understanding of business and its complexity, OST's come right along with us for that journey in the healthcare space.
What I find personally is their engineers, their architects, the senior leadership at that organization knows our business very well. They know healthcare very well from a provider and a payer side.
This is authoritative.
Yep.
At OST, we're not transactionally focused. We really focus on understanding the business customer from a broad perspective. We view ourselves as a true extension of their team. We augment and extend the teams that we're working with. So the data center services team has that context to apply when they start to solve those business problems versus just give me X number of CPUs or hard drives, or et cetera.
We may already have the design, and we go talk to OST's guys like Aaron or Jim and ask for validation on that design. And it's a very collaborative effort, and we've experienced that in our VMware environment. We've experienced that on our Oracle database environment. We have experienced that in our Tier 1 storage environment, and we're starting to talk through those sorts of things in a VDI implementation with them as well.
We've been working with VDI for so long, we basically wrote the best practices on that because we experienced every one of the downfalls that is possible in there. Storage is a critical component, and the performance of storage is a critical component in an end-user compute environment. We can help them understand that they won't be successful if they underestimate the criticality of that component.
So we also have a managed services team that is responsible not only maybe for monitoring somebody's environment, but all the way through managing their environment. So there comes that experience that they can leverage.
And the fact that OST is working in other areas of IS as opposed to just the infrastructure space, that really helps my relationship with them in that if something happens to be cropping up in another area that I'm not fully versed in, it's quite possible that OST is helping the business there, and we can very easily, quickly tie that all together.
Certainly the passion of Spectrum Health is around patient centricity. We want to do the best thing for the patient and member. We are aligned with OST in that passion, and that helps not only in your business partnerships, it helps in your vendor relationships when you're all in alignment around that. We're very confident that they are at the cutting edge of understanding the physician footprint across the nation. We're very confident that they understand how to leverage technology to innovate in those markets.
We're constantly learning. We're constantly discovering. We're open to new insights. We're open to vectors of thought that we didn't anticipate. And we're able to pivot quickly to take advantage of those new vectors of thought and create something useful and valuable, and do it fast enough that we can learn from the experiences of people who use the technology to create something that is iteratively better very, very quickly.